We are at Root and Restore in Haddonfield, and I just took an amazing tour of their facility. And what I found out that they are doctorates of clinical nutrition, and what I was really impressed is that their education went deeply into functional medicine. So I do want to ask you guys, since you guys are clinical doctorates of nutrition, right? What is the one thing that most people get completely wrong about your guys' profession and your specialty?
Yeah, I'll start us off here.
Yeah.
I think that the biggest misconception, or what people expect nutritionists to do, is to give people a meal plan. That's really not what we're doing. I mean, sometimes I don't love giving meal
We
plans.
give ideas.
We give ideas, yeah, and like you can apply it to however it fits in with your life. But really, we're assessing the function of different organs and systems and seeing what is causing stress on the body, whether it be metals, chemicals, food sensitivities, immune system issues. We'll put together plans to address those things. So it is definitely more involved than just doing meal plans. Of course, we love using functional foods and we really take a food as medicine approach, but
Nice.
it's more than meal plans.
More than meal plans, for sure.
Yeah.
Yeah, I think people expect us to tell them exactly what to do. Like, this is your breakfast, this is your lunch, this is your dinner.
Yeah.
But we're like, okay, so you want to eat in this way, and here's a bunch of choices. And so, yeah, I think it's a little bit more involved than a lot of people think.
Yeah. And we're really looking for a lifestyle change. That might not be for
Amazing.
everyone, but if we just told you, oh, you need to eat eggs for breakfast, that's really not empowering you to make different choices for your entire life.
Mm. And uh, actually, as a functional practitioner myself, um, knowing that your guys' role, I actually was like so intrigued to find that it was not just food, and then it is so far beyond. Can you elaborate on, wow, like of course food affects every organ system and every function, but what do you guys like? How do you tackle an individual that comes to your practice and how to start to formulate a plan for them?
I think based off of our education, we know everything starts in the gut, so we always
Wow.
start there. But then when we get past what the basic step is, we'll get a little bit further into some of these other more intricate, I would say, things that people would want to be working on. So it's a little bit of everything, basically.
It really depends. That's a hard question to answer because it
Yeah.
truly depends on what is going on
With a
with
specific person.
someone's terrain. So yeah, but really we're looking at like, okay, where is their stress in their body? What's stressing them out? And how can we bring the body back into homeostasis?
Wow.
Yeah, and we use a lot of food to do that, of
Yes.
course.
And then lifestyle,
Mhm.
other factors as well.
Yeah.
Like we typically focus on, not that we like to call what we do a detox, but we focus on detoxification methods that help
Yeah.
to flush
Mhm.
things out of the body, like the metal, the chemical, the immune system stuff. So sauna sessions are typically something that we recommend. So
Yeah.
yeah,
Mm.
much more than nutrition.
Much more. I found out
Yeah.
much, much more. And then I like what you said. Everything starts at the gut, and I think the world has absolutely come to recognize that.
Mhm.
Yeah, the gut-brain barrier and
Yep.
everything else.
Everything
Yeah.
trickles down from there. Yeah, I tell people, like, even your personality is completely dependent on your gut. People are
Wow,
like, wow, it's crazy.
that is crazy. So that leads me to ask. So, can you walk me through a moment where your approach change someone's situation in a way that you didn't expect it to change?
I think we each have a really good story for that one.
Yeah, why don't you start?
I kind of like what we were talking about earlier with that woman that was seeing her endocrinologist,
That's right.
who told her that it was impossible for thyroid medication to affect her heart. And I kind of encouraged her. I was like, I think, maybe you should get another endocrinologist. You should get another second opinion on that. And they scheduled her for open heart surgery because her endocrinologist was so convinced that thyroid medication could not affect her heart. The heart surgeon told her to stop that medication, and her problem completely disappeared. So for me, that was a really eye-opening moment because it wasn't even something that I did. It was something that another medical professional kind of pointed out, but it was something I'd been saying to this patient for 8 months prior to what was going on. So I think that the whole body aspect, not just like a nutritional aspect, and she ended up working off of medication,
Cool.
thyroid medication, with nutritional things
Yes.
alone. So just how everything is a little bit interconnected, that to me was a little bit mind blowing in that case.
You have to elaborate on, you kind of made it a little bit less scary, but when you told me that story of that person literally being on,
On the table when the heart surgeon told her to stop that medication, they basically had her under the knife.
okay, that is really scary.
Yeah.
And in our world, all too often people prematurely go into surgery before something is needed. So that resonates with me tremendously.
Yeah, especially now. I see this woman every so often. Like, I'll just see her out,
Yeah,
and she doesn't take thyroid medicine anymore. She doesn't
that's
need anything. She has
wild.
no issues, and she just maintains her diet and her other lifestyle factors. Like, it's more than just diet for her, absolutely. But there's a lot of other things too. Like, stress for her was a really, really big one.
Okay. So that's a ideal outcome where they
Yeah.
literally got off of her thyroid medication and lifestyle took care of it.
Yeah, yeah, with the blessing of the new endocrinologist too. The new endocrinologist was like, "Goodbye, I
Yes.
never want to see you again."
See, that's amazing. That's
Yeah.
a huge success story. And then Dr. Laura,
Yeah, I actually have one
Mhm.
that I love telling people. I had a patient who was in and out of the hospital with COVID for, I think, at least 2 years. He was really going through it, struggling. He ended up on oxygen, and this family is very dedicated. So their food, their lifestyle is very dialed in. So I can't take 100% credit for that. But, through our work together, he does not need oxygen anymore. Yeah,
Wow.
and they told him he would be on oxygen forever. Yeah.
Whoa,
Yeah.
that's incredible. I mean, just out of curiosity myself, their food and everything was dialed in. What was that factor that you helped them to facilitate that journey to where he does not need oxygen today?
Yeah, good question. And this did not happen overnight. Like, we have
Yeah.
been working together for a long time. I think if I had to pinpoint it on one thing, like because we use a lot of applied kinesiology, a lot of muscle testing, we can really
Yeah.
get specific with the stressors on the lungs. So that really was a key
Wow.
factor with that, and just inviting healing into that area
Okay.
with very targeted support.
Amazing. And what I did find out is that Dr. Laura and Dr. Abby both use homeopathy, which is
Mhm.
something that I'm not so familiar about. But would that be something that you would incorporate into a
Yes.
patient's?
Yes, absolutely.
And it definitely depends on the individual, the applied kinesiology, the muscle testing that we
Okay.
do. That's what we do in addition to our clinical evaluations. So
Yeah.
that's what we kind of assess and go forward with when we don't have anything further. So we'll go kind of there, and then if we need, we'll branch into the advanced testing, like the functional medicine stuff.
Wow.
Yeah.
So wild. So
Yeah.
beyond what I expected. I learned so much today.
Thank you. Thank
And
you.
then our last question, what does it look like when someone is truly ready to work with you, and what happens on the other side?
Okay, so we see a very big spectrum. I'm sure you do as well in your practice
Yes.
of readiness to change whatever it is that you're looking to change.
They
and
have to be ready.
Yeah,
Yes.
they do have to be ready, but there's also a spectrum to it. Like, I think the people who are the most ready have really been through the ringer with their health. Like, they have exhausted all of their options. They're kind of coming to us like, this is really the last thing that I'm trying.
I hear that a lot.
And they're willing to change their diet. They're willing to get rid of the bad, quote unquote, bad habits that have really progressed their health in a
Yes.
negative way, and putting in good habits that support health.
Yeah, I definitely think that changing the habits themselves is the hardest
The
part.
hardest.
Yeah, like I
Yeah.
can tell people what to do and they're like, yeah, I could do that for 2 weeks. And I'm like, I'm not talking about
Yeah.
2 weeks. It's talking about a little longer than that.
And there are some things that are short term, like food
Yeah.
sensitivities. They change, especially when you're changing and supporting the GI tract and the microbiome. But like, oh man, a bad habit that I have is watching TV at night. And like, I know that it's messing up my circadian rhythm.
All of us
but-
do. We
right?
need a de-stressor, you know?
But if that is significantly impacting someone's quality of life,
Wow.
if it's impacting their ability to produce melatonin and causing them, bad sleep at night, then that's something that they have to be willing to let
Wow.
go of and
Wow.
replace with something healthier.
So you even go into as far depth as those lifestyle changes
Yeah. Yeah.
to treat the whole person.
The whole
Yeah, we
person.
have to look at the whole person.
Wow.
Especially with the blue lights later at night, it not only
Yeah.
eye strain, but eats up the RNA in the eyes and
Mhm.
everything, and it
Yeah.
completely changes the way that the
Wow.
muscle is working. So
Wow. So what is the ideal outcome for anyone that comes to you guys?
Well, we have our ideal outcome,
Yeah.
but they're going to come with their own ideal
Oh, okay.
outcome too, right? It really
Sure.
depends on what their health goals are. My ideal outcome is that we're really giving you education, information, and the tools that you need to support your health long term. Now, I see a lot of fertility, so we obviously want to get pregnant, right? Have babies, but yeah.
yeah, I think that it depends on the person for sure.
Sure.
So I have a lot of people that come to us and they're like, my labs are normal, but I don't feel
Mhm.
normal. So I think that the goal is
Ooh.
just feeling better
Yes.
overall. So that way the person feels better. And
Mhm.
like even if the lab work doesn't change or nothing there, if you're feeling better, I think your day to day is better. But yeah, it definitely depends on the person. Like if someone comes in to me and they're like, I want to work off of my medication, I'm like, I am there for you. Talk to your doctor and let's see where we can go.
Yes.
So that is definitely a different thought process than someone who just wants to feel better. Like
Mm.
the effort level and
Yes.
the readiness level definitely needs to
Mhm.
reflect that goal.
Gotcha. Gotcha. Wow. So you're saying that is actually possible to have someone get off their medications.
Yeah, I had a
Seen it,
woman
yeah.
who worked with me for 6 years who had half a thyroid and was able to maintain her values with just supplemental nutritional lifestyle factors.
Perfect.
Yeah, we're
you're-
not managing medication.
No,
That's not
no,
our
no,
scope,
that's
but we can support the nutrition and lifestyle.
Yeah.
That's right.
Yeah.
Yeah, always the blessing of the doctor. The
Mhm.
endocrinologist in that case was like,
Yeah.
wow, I can't believe I'm saying this, but I
Yeah.
don't think that you need to come back.
Wow.
But yeah, that was the craziest case that I've had of the body is so capable, the body is so regenerative that
Mhm.
if you have the drive and the want to
Right.
do that, then
And
your
the right
body-
tools.
and the right tools. Yup.
Because
your
you can
body-
have the drive and the want, but if you're not implementing the right tools,
Yes.
it's only so far that you can get.
Yes.
so many different factors.
Yeah. I think that is just magical what you guys do.
Thank you.
It's
Thank you.
amazing.
What is the thing that most people get completely wrong about your field?
Great question. Since we are deemed a physical therapy clinic, people think that they need to be injured or have surgery to come see us. But we are really very much a very holistic functional practice. So, for instance, someone came the other day where, we definitely saw her for her back. And she complained of knee issues, but she's like, the very thing that you spoke to me about was that when I had stomach upsets and irritable bowel syndrome, and that she felt weird coming to a physical therapy practice to see us for that. But yeah, she had lower back issues and hip and knee issues. But little did she know her back issues were related to a gut inflammatory issue that literally turns off her core,
Yeah.
doesn't allow her core and her body to support her lower back and her pelvis, that led to the knee issues. So in that sense, gosh, we just cover so much more.
Yeah.
We cover so much more. And instead of just going at the neuromuscular standpoint, like we literally look at the whole body.
Whole body. Yeah.
Yeah. And honestly, our saying is where you think where the pain and the issues are, it is not.
Yeah. Yeah.
Majority of the times, at least.
Yeah, I love that. We have a picture of how the nerves kind of correlate to different organs. So like goes
Yes.
down the spinal column and then wraps around the body. So that's what we'll do. We'll point out to people like, yeah,
Yes.
you may feel the pain here, but it
Right.
could be referred from over here.
It's usually 2 or 3 areas away. It's pretty crazy how after 15 years, like almost nothing where the symptoms are is actually the issue.
Yeah. And I love actually how you guys changed your name. I saw recently to have the
yeah.
functional medicine in
Yeah.
there too. Because I did the same thing when I first saw you
did?
guys. I was like, sports medicine. Okay, so it's got to be more sports related. And then when you changed the name, I was like, ooh, I like that. That sits really well.
Oh, awesome. So we are like very much in the same
Thought process.
Yes, so
Yeah.
much. I could not. Yeah, I was flabbergasted to find out that our thought process was so alike.
Yeah, and
It's so cool.
I love how, like I said earlier, you really align with the physical component, which is not something that we really get into at all. Like we know that it's there, but
Right.
as nutritionists, we don't touch really that aspect. So I loved how you were describing earlier about the difference between the fascia and how, like Laura was saying, the scars and everything.
Yes,
I
yes.
absolutely love that.
And then for us being on the physical side, right? Like we don't know deeply into the hormones and at the chemical and nutritional side. So it's a very, very great community to have to be able to work with you guys.
Yeah, super complimentary.
I think so.
So then, can you walk us through a moment where your approach changed someone's situation in a way they didn't expect?
Wow. Gosh, there's so many stories that's why I went back into a little bit more studies to put the science behind what we do into the functional medicine accreditation that we have. But gosh, there's this guy, Bill, who's a farmer, came in with low back and shoulders and neck pain. And on the other end, he had a diagnosis of congestive heart failure
Oh, wow.
that I told you guys about,
Yeah.
right? And the doctor literally gave him 2 years, essentially, that if this continues to progress, like we will have heart failure and
Oof.
you will not continue to live, right? But like, gosh, we didn't know how to tackle that, but just having been able to take care of the neck and the shoulders and reset the neural system. I found out they came from a very, very entrepreneurial background, and that is just kind of along with that, just a lot of stress and constant issues and employees and things like that. So when we were able to balance out the sympathetic and the parasympathetic neural system and start to get his what we call our metabolic pumps, our cardiothoracic and our gastrointestinal pumps freed up, miraculously, of course, his neck and his shoulder pain went away. But when he went back to the cardiologist, his heart volume and his heart function went back to normal.
Wow.
And gosh, to be able to, yes, get someone out of pain, but to have them reclaim their life that they thought was ending, that was very unexpected.
Yeah, that's a good side effect of doing something is, wow, this got better.
That was a wild one. And then, yeah, and we have, we are a longevity clinic now, and we quite happily see 90-year-olders, right? And we had an awesome gentleman, 89 years old, almost 90. His name was Harry. He came in with low back pain. He had a history of kidney failure. And again, same story. We took care of the system. We balanced out the neurological system so that it could be homeostatic. And his kidney failure Right. Well, basically, his kidney is starting to produce the right
Ooh,
type of function again,
heck
and
yeah.
the internist could not believe what they saw.
I love that. I absolutely love
It,
that.
it is so wild.
Yeah,
Yeah.
just ogling conventional medicine is like, wow, how did that happen? That's crazy.
And that's why I, coming from an Eastern medicine background, and I know people say there's a lot of foo-foo-ness and tons of
Yeah,
it's not real
we get
medicine.
that too, absolutely.
But luckily the world is catching up, and the research behind acupuncture and the meridians, and how the metaphysical world of being spiritual and being showing gratitude and joy actually makes the very chemicals in the medication, if you will,
Yep.
that helps you to heal.
Yep. Yeah, I tell everyone that all of our patients, I say, your body doesn't know what kind of stress it is. If someone hits you versus if you're sick or if they're
Yes,
mean to you, it's all stress that your body has to deal
that's
with,
right.
and it's got to come out somehow.
That's right. At the chemical level, the organ level, physical, joint
That's
level.
great. That's great. Oh, I love
It is
this.
wild.
So then what does it look like when someone is truly ready to work with you? And then what happens on the other side?
Great question. It's very similar to you guys, actually.
Yeah.
It's someone who's feeling like, maybe you're in your 40s and 50s, and a lot of our people are in their 60s all the way to 80s and 90s, right? They feel like their body is falling apart, breaking down. They've gone to multiple specialists, the orthopedist, the massage therapist, the acupuncturist, the chiropractors, and other physical therapists, and they feel like they just cannot get ahead. Everything feels like they're separate things breaking down, and they're just so tired of this hamster wheel of breaking down. And we tell people, like, if you were to come to us to figure out what the root causes were and not chase the symptoms, um, that then this is probably going to be your last stop. And I think the coolest stories are that people, like, we have a guy, John, coming from White Plains, New York, driving five
Wow.
hours each way for 6 weeks to actually find some answers,
Wow.
and um, and he was able to get out of his lower back and hip pain that he's been chasing for 10 years.
That's great. Other side.
That's right. Yeah. So in reminder of that, yeah, like, people are just, they're getting no answers with other practitioners, and they're so happy to find us through word of mouth. And it's kind of a little bit more known now that it's not just
Physical
the
therapy.
physical and the
Yeah.
symptomology anymore. And yeah, and like, people that were told scoliosis was something that you're probably going to have to live with for the rest of your life, or a bone on bone joint that you're going to have to deal with and eventually get a joint replacement. We're happy to say with full confidence that we're able to reverse that, and you
That's
never have to go
great.
to surgery. Yeah,
Ooh.
it's
Yeah.
wild. In the last 15 years, we've only sent 3 people to an actual joint replacement surgery. If you just balance out the body, your body has an incredible amount of capability to heal and regenerate,
Yep.
honestly.
Yep, that's what
Yeah.
I say too. The body is so regenerative, so capable. Like I mentioned this at the workshop the other day, but
Yeah.
you have to have like lost 70% of your liver function sometimes for it to come
Yes.
up on ALT, AST,
Yes.
and the
Yes. Oh my
thyroid
gosh.
is 40%. So your body is 30% dysfunction and you're not feeling well, but the labs
Yes.
are
But the
normal.
labs are
So,
normal.
yup,
That's
yup.
right. Yeah, I think you hit it right on the head. What's average today is definitely not optimal.
No, no. Yeah. And again, average is not optimal in any regard. Like
Yes,
again from the
today.
workshop with the RDA, that's your average, your dietary allowance, but that's literally to prevent you from starving. That's not
Yes.
thriving and doing
Yes.
well.
Yes, and I think it's so appropriately named, right? When you mentioned that the workshop that you held for us, the SAD diet, the standard American diet. I'm like, yes.
Literally sad.
Yeah, yeah. And thank you so much.
Of
Our
course.
clients are loving your local sourced
Yeah.
um, like food sources to look